My name is Aaron Nowak, and today I will be talking about the broken healthcare system in America. So, some brief history of healthcare in the United States. Signed in 1965, Medicare is a federal health insurance program primarily designed to provide coverage for Americans aged 65 and older. It also covers some younger individuals with certain disabilities and those with end-stage renal disease. Medicare is divided into parts, with them being hospital insurance, which covers inpatient care. Medical insurance covers doctor's visits, outpatient services, and preventative care. Medicare Advantage, which allows beneficiaries to enroll in private health plans that apply both hospital and medical insurance. Then there is prescription drug coverage, which provides coverage for prescription medications. Medicaid is a joint federal and state program that provides health care coverage to low-income individuals and families. Medicaid covers a lot of medical services like medical visits, hospital stays, prescription drugs, and more. Medicaid is needs-based, unlike Medicare. The Affordable Care Act was signed by Barack Obama in 2010. This was meant to improve the cost, quality, and access to healthcare. The COVID-19 pandemic of 2020, which exposed vulnerabilities of the U.S. healthcare system and brought up issues of access, equity, and preparedness to the forefront. So, my personal experience with the healthcare system in the United States, my cousin Johnny suffered from some serious back pain and struggled doing day-to-day things like working, standing up, sleeping, and even just getting up to go to the bathroom. He owned his own construction company and worked like very long hours and still couldn't even afford health insurance. Due to this, doctors wouldn't even see him just because he didn't have any kind of insurance for health. After a couple of weeks, he was able to get some kind of health insurance, but it still wasn't enough. He was underinsured. Since he wasn't able to afford the medications he needed, he ended up turning to a street drug. And 2 years ago, he took some kind of street drug, and it was laced with fentanyl and had all different kinds of things in it. My cousin was admitted to a hospital in Baltimore, where I watched him lay there, and the only thing that was keeping him alive pretty much was the machines. It was breathing for him and keeping his heart going. He also died later that day, and there were a lot of factors that played into the outcome of my cousin's situation, but the biggest one was the failure of the healthcare system. So, lack of universal coverage. There's a very large lack of universal coverage in America. And as of 2021, there are approximately 28 million Americans that are underinsured, and millions more are underinsured, meaning that they have insurance, but they struggle to afford any type of medical care. And this was provided to me from the Kaiser Family Foundation. There's also a lack of universal coverage, and it exacerbates existing health disparities, with minority and low-income populations more likely to be uninsured or underinsured. Another thing are medical bills and healthcare-related debt. They are a large leading cause of personal bankruptcy in the United States. This goes to show the financial toll that lack of coverage can take on not only individuals, but their families as well. I even witnessed my dad struggle with these high-priced medical bills when I was younger, and he ultimately had to file bankruptcy from them. While the Affordable Care Act is supposed to prevent this, it still occurs today. The high cost. In 2020, the U.S. alone spent approximately $11,000 per person in America just on healthcare. And that is significantly more than most developed countries. Prescription drugs costs aren't always covered, and these drugs can be very expensive. The cost of prescription drugs in the U.S. are noticeably higher than in other countries. In fact, they are 2.4% more than Australia, Austria, Belgium, Canada, Germany, Japan, Sweden, Switzerland, and even the UK, and that was provided by pgpf.org, The US spends a higher percentage of its healthcare dollars on administrative costs compared to countries with universal healthcare systems. Administrative expenses in the US are estimated to be around 80% of total healthcare expenditure. Administrative complexity. The US has a fragmented healthcare system with a multitude of private insurance companies, each with its own set of rules, policies, and paperwork. The complexity of this makes it difficult for healthcare providers to navigate the reimbursement process. A lot of insurance companies deny claims, which leads to appeals and administrative work for both providers and even patients. Different insurance plans have varying levels of coverage for specific services and medications, which makes it challenging for patients to understand what is going on, what is going to be covered and what will not be covered. Health disparities. So disparities in health insurance coverage continues to persist. For example, Hispanic and Black populations are more likely to be uninsured compared to white populations. Also, low-income individuals are more likely to be uninsured or underinsured. Many minority communities have limited access to healthcare providers, leading to delays in their healthcare and poorer health outcomes. Certain chronic conditions like diabetes are more prevalent among minorities, which leads to disparities in health outcomes. So that is the end of this, and if there's anything I've learned from how broken the healthcare system is in America, it is to take notice of this and just pay attention to things going on and try and make some kind of difference and just educate people on this so that way you don't have to witness what happened with my cousin happen to your family as well. Thank you.